Hello, everyone. My name is Amir Rand. Thank you for joining us today. We'll be getting started shortly. We're just going to give people a few more minutes to come on in and join. We'll be back in just a moment. Just enjoy some easy listening for a little bit. Thanks. Good evening, everyone. My name is Amir Rand, physical therapist and regional director at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who've attended one of our other webinars, as well as welcome those who are joining us for the first time. We appreciate you taking the time out of your busy days to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years with over 20 locations located all over the New York City area. We've successfully continued to offer in-person care through the COVID-19 pandemic, as well as launched Spear Live for those of you looking to stay in and receive care using our telehealth platform from the comfort of your home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We are here for you in whichever way makes you feel most comfortable. If you're looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. We are excited to be with you today to discuss low back rehab and core strengthening. We'll be discussing low back and core anatomy. We'll be going over some exercises that can reduce low back pain, as well as discuss the science of pain. As part of our session today, we'll be talking through demonstrating some of these exercises, and we welcome you to follow along and participate with us as you feel comfortable. Please note, if you're experiencing any pain while performing any of the exercises, or you feel unsteady or unsafe to do them on your own, definitely stop and reach out to us directly so we can support you. As you can see, we're coming to you live from our own homes, and although we do not anticipate any technical issues today, please be patient with us should any arise as we navigate through working through all of this technology. All right, a little bit of housekeeping for this webinar. We want to hear from you. So if you have any questions, please feel free to let us know your thoughts in the Q&A feature below. To find out, to find where that is on your screen, please just hover over that with the mouse. At the bottom of your screen, you'll see the Q&A option pop up. That is where you'll put your questions, and we'll do our best to address as many of them as we can during the webinar, as well as at the end. For those of you who are watching through YouTube Live, we are monitoring those comments in the comment section, so please let us know, and feel free to type your questions in there as well. Lastly, there will be times where multiple panelists are on the screen. For the best viewing experience, please select Gallery View at the top right corner of your Zoom screen, which will be able to see multiple panelists at one time. Okay, let's talk more about our goals for the day and review what we'll be covering. First off, we'll be reviewing some low back and core anatomy. We'll then shift over a little bit to go over some exercises that reduce low back pain with Jeff and Kyle. And then we'll revert back to Jeff to go over some pain science. And then most importantly, we'll answer all your questions live. Before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone onto the screen now to join me. Hey, Jeff, Kyle.
Hey.
Our presenters today are Jeff Smith and Kyle Veltre. Jeff is a physical therapist and clinical director of our 30 Broad Street location. Say hello to the team.
Everybody, thanks for joining us tonight.
Kyle is a physical therapist at our 30 Broad Street location.
Hey guys.
And lastly, we have Don Squire, who is dressed to impress. He's just joining us from our holiday party where we all dressed in our fun holiday attire. So thanks for joining us, Don.
Happy and safe holidays to everybody.
Don's going to be helping me answer your questions in the chat feature, as well as curate some information later on in the session. Again, let's turn to gallery view so you can see everyone at the same time. And let's take it away. Jeff's going to kick it off.
All right. Thank you for the intro.
Don, say goodbye. All right, Jeff,
take the intro here. Appreciate it. The first slide we have coming up here, just before we dive into the fun stuff of the low back pain and core strengthening webinar, I just want to review some anatomy real quick so we know what muscles and structures we're going to be working on. So the picture here looks really intimidating at first, and we're not going to dive too much into the exact musculature, but the really big takeaway I want everybody to take out of this slide is that there's a lot of things going on in the lower back. It's not as simple as, just a knee or ankle. There's a lot of things tying into this area of our bodies. So as you can see, bunch of these muscles are responsible for providing stability and also mobility to our torso. And these muscles are going to work together to brace ourselves and prevent injury, as well as provide pain-free motion. So speaking of pain, before we dive into it, I just want to speak about some these structures that can be injured. Typically with a low back injury, there are 3 structures that are involved. And it could be one or all 3 of these, but muscles, nerves, discs, and bone are the 4 primary structures that can be injured in the lower back. And whenever we ask on our first assessment of what kind of pain are you in, it's going to let us know how intense the pain is. That's going to help guide our exam to let us know exactly what is injured. So the common question you're going to hear is, on a scale of 0 to 10, how much pain are you in? When I work with my patients, I like to give them a little bit more guide work to help kind of frame that question a little bit better. So on a scale of 0 to 10, I'll say 0 is no pain, 10, we have to go to the hospital, it hurts so bad. And a 1 to 3 would be a sore, it's uncomfortable, I'm aware of it, it's annoying. Those are all kind of 1 to 3 level. Anything higher than that is going to be 4, 5, 6 plus. So keeping that pain scale in mind throughout the session, generally we say with PT, a 1 or a 2 is a generally safe level to work through. However, as Amir mentioned earlier in this webinar, if you are experiencing any pain, make sure you let your physical therapist know about it so we can address that. Now, it's also important to know what type of pain you're experiencing. So when I work with my patients, I like to try and give some adjectives to make sure we're on the same page and I know what structures are involved. So for example, you might have soreness or tightness. Those are signs of muscular pain. Tingling or numbness are signs of nerve pain. A deep aching that can't be relieved with stretching or massage or heat is generally indicative of bone pain. And then finally, burning or shooting pain can be either nerve or muscle pain, depending on where it's located. A quick example, burning or shooting pain on the side of the arm out here could be a rotator cuff or muscle pain, whereas tingling, burning, numbness going down the glutes and back of the leg to your toes can be a sign of nerve pain. Regardless, if you're experiencing burning or shooting pain, it's a sign of a more serious injury, and you absolutely should go see a physical therapist and or a doctor to have that looked at. Now, I'm going to bring Kyle onto the screen, and we're going to talk a little bit about exercises and demonstrate some exercises for you.
All right. Awesome job, Jeff, going over some of the anatomy and some of the pain stuff. Now we're getting into the fun things, guys. We're going to start with some exercises. Feel free to join us, as Amir said. I'm going to have Jeff and use him as a model, go through some of the mobility stuff first, and then we'll get into some more core strengthening after. So the first exercise I want to go over is called double knees to chest. So with Jeff laying there, I'm going to have him bend his knees up with his heels coming back up toward him, with the feet first starting on the ground, and then he's going to lift both knees up at the same time, and then give himself a big hug using his arms, pulling those knees into his chest. We should just be feeling a nice gentle stretch going through the low back. With this one, we want to hold for a couple of seconds and then lower back down. After that, we can try a couple more repetitions, trying to loosen up that lumbar spine. How's it feel for you, Jeff?
Feels great. And Kyle, should my low back be coming off the ground when I'm doing these, or should I stay flat on the ground?
Yeah, so you'll notice as you pull those knees up further and further towards your chest, that low back can start to tilt up off the ground. That's just going into a deeper stretch. So as tolerated, you can pull as deep into that stretch as you can. Try and get that nice gentle stretch through that lumbar spine. Awesome job. Cool. So for the next stretch and mobility, we're going to have Jeff stay in the same position, but just bring the knees closer together so that they're touching. This one is called lower trunk rotations. So with Jeff lying there, he's just going to let both knees fall from side to side, almost like a windshield wiper, just until he starts to feel that low back come up off the ground, and then he's going to come back and switch to the other side. Again, we're trying to hold for a couple seconds at either side, doing this exercise more for repetitions rather than for holding. How's this one feel, Jeff?
It feels good. Now, Kyle, should my shoulders are popping up off the ground, do I want to keep those flat on the ground, or should I be letting those roll as well?
Great question. So that's a common compensation that we see with some patients. Ideally, we want to try and keep those shoulders down on the ground. That really helps us isolate the lumbar spine. As that shoulder starts to pop off, you're starting to incorporate some of the upper spine and the thoracic spine. And for this exercise, we really want to isolate the lumbar spine. So great pointing that out. Awesome. So for the next two, we want to try and get into some stretching. So the first stretch is what we're going to be calling a hamstring stretch. So I'm going to have Jeff again demonstrate this one. He's going to go ahead and grab that stretch strap for us. Again, he's going to lay back down on the ground, tying the middle part of the stretch strap right under the arch of the foot, holding both ends with either hand. Now at home, if you don't have this stretch strap, you can use a towel, a long sheet, or even a belt to try this exercise. And then what Jeff is going to try and do is gently pull up that leg towards the ceiling, keeping his knee nice and straight, just until he starts to feel a stretch coming back down the back of the thigh. How does that feel, Jeff?
Feels good. Now, I'm starting to get some pain in my lower back with this. Is that normal, or what could I do to make that not happen?
Great question again. So one way we can sort of alter this exercise and still get a good stretch without having any low back pain is to bend the opposite knee as well prior to lifting the leg up. That helps us rotate that pelvis back, keeping a nice flat back as you pull up. You may be able to pull a little bit further. We just want to make sure that the knee is staying totally straight and extended as you pull back to get a really good stretch out of those hamstrings. Now for this exercise, we want to try and hold it for a little bit longer, 20 to 30 seconds, and try that for a couple repetitions and then switch sides. How did that feel? A little bit better on the low back?
Much better, yeah, thank you.
Awesome. Cool. So that was the hamstring stretch. The one last stretch we want to go over is called the piriformis stretch. So again, similar position. Jeff is going to start laying on his back with his knees bent up first. And then he's going to cross over one foot on top of the opposite knee. We call this a figure 4 position. And then what Jeff is going to go ahead and do is grab the back of his thigh of the bent knee and just pull that gently towards his chest until he starts to feel a stretch going down the back of his opposite hip. Where are you feeling this stretch, Jeff?
Right in this area, all through here.
Perfect. That's exactly where we want to try and hold this stretch. Again, because it's a stretch, we want to try and hold this one for about 20 to 30 seconds. Again, completing 2 to 3 repetitions and then switching sides. Looks great, Jeff. So now that we're all loosened up now, we want to try and get into some more core strengthening exercises and some hip strengthening. I'm going to invite Jeff back onto the screen. We'll go over those with you guys.
Cool. All right, so Kyle's going to be our model this time. He's going to get on the floor. We're going to start off with 2 pretty basic core strengthening exercises. And I mean, when you meet your physical therapist, they're going to be able to go through a ton of exercises and give you a program specific to what's going on with your condition. But these are just some really basic things you can do. It doesn't require a lot of equipment, and you can do them in the comfort of your own home or apartment. So the first thing we're going to do is an exercise called bridges. So Kyle's going to lie flat on his back with the knees bent, feet flat on the ground, and the feet should be about shoulder width apart. And he's going to embrace his core. He's going to get that core nice and tight. He's going to try and pull that belly button down to the floor, make sure everything is engaged there. Now, while maintaining that core engagement, he's going to lift his hips up off the ground as far as he comfortably can. Perfect. Going to hold that for a second or two, and then slowly lower it back down. And the muscles that are being worked in this exercise is going to be the obvious core muscles that are engaged. He's also going to have his glute muscles on his bottom there working to help lift him up. And he's going to also get a little bit of hamstring and quad musculature being activated as well as he maintains this exercise. And again, this is a very basic exercise you can do to help get the ball rolling and get things, the muscles strengthened in that core area. Nice job, Kyle. The next one we're going to do is a little more advanced. It's called a dead bug. So Kyle's going to be flat on his back again. And he's going to have his hips and knees bent just like that. Head is relaxed. And now he's going to have that same type of core engagement, trying to bring that belly button down to the floor. And while maintaining that, he's going to extend his right leg like so. Yep. And he's going to tap his opposite hand to the knee, going back and forth. Alternating opposite arm and opposite leg. And the entire time, his back should be flat on the ground with that core nice and tight. Is your back popping up at all, Kyle, or is it nice and flat?
It's starting to pop up. Is there anything I can do to try to avoid that?
Yeah, so if your back starts to pop off the ground, it just means the exercise is a little too hard. These compensation patterns that Kyle and I keep bringing up, shoulders coming off the ground, low back popping off the ground, these are all signs the exercise might be a little too difficult for you, and we need to bump it down a little bit and make it not as intense. So one thing Kyle can do, instead of having his legs extending out, he can drop his heel straight down to the ground and repeat, like so. How's that? Are you able to maintain your low back a little bit better, Kyle?
Much better, yep.
Perfect. Excellent, just like that. And both these exercises are going to be done with sets and reps. A very common set and rep scheme is 3 sets of 10 repetitions. But again, your physical therapist will give you your exact set and rep scheme depending on your condition and your injury specifically. So the next one we're going to demonstrate are going to be 2 more exercises. These are a little more advanced and it's going to require a little more muscle activation in the hips and core. The first one's called a bird dog. So Kyle's going to go on all fours here. And by the way, we did not name these. These are pretty standard terms throughout any physical therapy clinic you go to. So we were not the brilliant minds behind this one. So keeping that core nice and tight, he's going to have his back flat. He's going to extend his left leg and his right arm simultaneously while maintaining that core. Perfect, just like that. And we're going to keep the back nice and flat. Hips are going to be nice and square. And he's going to bring the knees and hand together and opposite side now, just like that. And a common cue that I'll give my patients is imagine you have a glass of water or your favorite beverage resting on your lower back there. We don't want your hips to turn over and dump that water. So you want to make sure that everything is nice and controlled this entire time. And this is going to mimic a lot of sports we do. When we're running, jumping, throwing things, we have to have our core engaged while also moving our extremities. This is a really good exercise we can do to help build up that strength. Nice job. And the last one Kyle's going to demonstrate is a plank. Very common core exercise. There's a ton of ways you can do, a ton of variations you can do this exercise. We're going to show you the most basic plank on elbows. So Kyle's going to go onto his elbows here, going to have his hips up off the ground, legs are going to be straight. And the goal is having his back and hips all in line. Going to drop his bottom just a little bit. So he's nice and lined up. Good. Straight like a board. He's going to maintain that for time. Generally, we'll start with 10 seconds, 15 seconds, working way all the way up to a minute. And sometimes people can go even further, up to 1.5 minutes or 2 minutes. Nice job, Kyle. You want to take a break? Some common compensations you might see with this. Kyle's going to just go through some things. One would be lifting your bottom up in the air to maintain that position, like that, or dropping the hips too low on the ground and you get a kind of U shape in the lower back. These are all signs that, again, the exercise might be too difficult, or maybe you're trying to hold the core for too long. I always say quality over quantity. I'd rather my patients be able to do the exercise with proper form for the sets and reps than do some of these compensation patterns and not get the full benefit of the exercise.
Nice.
How'd it feel, Kyle, all right?
Pretty good, but I need a break. You mind doing one?
Perfect timing. So Kyle's gonna demonstrate or explain the last few exercises, a little more advanced core strengthening exercises now.
Yeah, Jeff drew the short straw on this one. He's gonna do the toughest one. This one's called the V-up. So definitely more challenging than the last 2. So once you feel comfortable doing those, you can try this one. But definitely if you're ever having any pain or you feel like you're unable to do the form correctly, definitely dive it back down to the previous exercise and try those first. So Jeff is going to lay flat with his arms raised over his head to start. He's going to think about trying to fold his body into a V shape, bringing his hands to meet his feet right above him as he lifts up. Good. Nice. And the goal with this one is to try and lead with both the hands and the legs at the same time. Try not to lead with just the hands or just the legs. We want to try and simultaneously lift both up, engaging the core the whole time, trying to fold yourself into a V at the very, very top. Nice. I won't make you do any more, Jeff. I'm not that mean.
Chipotle for lunch. I'm good on that.
Great. So I'll give you a little bit of a break. You come back on screen and talk to us a little bit more about pain signs.
Awesome. Thank you, Kyle. Oh, the abs are a little sore after that one. I got to do more of those V-ups. So with pain signs is a new field that's coming out. A lot of exciting research is coming out. It seems every month there's a new article coming out talking more about pain signs. So pain is, as we mentioned before, something that if you're experiencing it, definitely stop and seek help. And we want to think of pain as the body's smoke alarm. Pain is a multifaceted phenomenon that includes not only physical structures, but also emotions and environment. And we shouldn't be afraid of pain. One of the leading researchers is Lorimer Moseley out of Australia. He is one of the leading experts in pain science right now, and he has a great analogy, and he calls it the smoke alarm analogy or fire alarm analogy. So when I talk to my patients, I explain that think of your pain in your body like a smoke alarm in your house or apartment. I don't know if you've ever been cooking or showering and set the smoke alarm off in your apartment. The apartment's in no danger of burning down from that stove or from that shower, but the alarm is doing its job. It's sensing heat, sensing smoke, and telling you to come to this room and pay attention because something isn't right here. So when you think of pain the same way, the pain is going off in your lower back, your hip, your neck, your shoulder. It's just a smoke alarm going off saying, stop what you're doing and get this looked at because this isn't normal. And then if we try and work through that pain, that's when the pain continues to get worse. So make sure we pay attention to that in the beginning. Also, more interesting research coming out from Lorimer Moseley. He speaks about how the severity of the pain doesn't always equate to the severity of the injury. And a perfect example is a paper cut. I'm sure we've all experienced a paper cut at some point in our lives. Paper cuts hurt like crazy, but there's a very little chance you're gonna lose your finger from a paper cut. People also have what's called an ACL injury. If you follow any sports, I'm sure you've seen a ton of those injuries occurring so far this year. When you tear your ACL, it hurts in the moment, but after a couple of days, the pain goes away. And it's not uncommon for people to live their entire lives, the rest of their lives, with no ACLs. So it's a pretty significant injury, but very minimal pain. So when you're experiencing pain in your lower back, the most important thing is to stop what you're doing, acknowledge it, and then go address it. So I'm gonna bring Kyle back on screen, and he's gonna go through some lifting mechanics and return to gym modifications you can make to the exercises at home.
Nice. Thanks, Jeff. This is a perfect segue into our last little section here, which is progression of exercises, going over some squatting mechanics, and sort of working through those exercises that we just did to try and make them a little bit harder if you feel comfortable, or a little bit easier if you don't feel as comfortable. So I'm going to say goodbye to Jeff for now, and then I'm going to pull up a slide here to go over some factors that we can change and manipulate to make an exercise a little bit harder or a little bit easier based on your tolerance. Now, it should be noted that the majority of these can and should only be altered by a treating professional, such as a physical therapist. However, there are a couple that I would like to go over with you guys today that are easy enough to change on your own based on how you're tolerating them. So the three that I'd like to talk about are the first one there, magnitude, frequency, and then variability at the very end. Now, we can think of magnitude as simply the mass of the object or the weight or the amount of resistance that you're using during an exercise. If we take up that V-up as an example that Jeff had so graciously performed for us before, we can make that exercise a little bit more challenging and a little bit tougher simply by adding a small weight into the hands as you come up into a V-up. The thing we want to make sure of, and we always want to make sure of, is that we're able to perform the exercise first with both good form and pain-free within the confines that Jeff talked about before, pain-free range of motion. Once you feel comfortable performing sets of 10, 2 to 3 sets of 10, go ahead and try making the exercise a little bit more challenging by changing the magnitude. Now that leads us into our second variable, which is frequency. This may be the easiest one to sort of alter. We can think of frequency as sets and reps, basically the amount of times that you do an exercise. So say you, for example, you're doing the plank. If you feel like you're noticing yourself getting a little bit better, a little bit more tolerable, holding a plank for about 10, 15, 20 seconds, all you can do to make it a little bit more challenging is try and increase or add an extra rep. So say you're doing 3 reps, trying to hold for 20 seconds, they're feeling pretty good, no pain, form looks great. Go ahead and try maybe a 4th, maybe a 5th rep. Or you can try increasing that endurance level by holding the plank for a little bit longer. Maybe try 3 reps at 30 seconds. Again, we want to make sure that we are doing the exercise both pain-free and with good form. The last exercise, or the last variable rather, is called variability. And that one is a little bit more intuitive. So I'm going to invite Jeff back on the screen here, and we're going to go over that one together with you guys. Cool. Jeff's back. Welcome back, Jeff. So variability. Again, a little bit more intuitive. For this example, I want to go over the functional squat. Now, we squat throughout our daily lives all the time, right? You can think about squatting down to the ground, whether to pick up a laundry basket, whether to pick up a heavy grocery bag, or even shoveling, which is perfect time given the recent snowstorm here, right? We think about squatting during any sort of activity that we do throughout the day. So when a patient comes to me with low back pain, I like to take a look at their back squat, right? I want to see what that looks like, especially if they're noticing an increased low back pain as they squat down to lift up any of those objects I just mentioned. So Jeff, do you mind demonstrating a squat for us just to see get a better visual of that?
Sure.
Right. So Jeff's going to keep his feet shoulder width apart and then squat down. And then as we watch from the side, good. Go ahead and squat down again, Jeff, for me, and then try and pause right at the bottom there. Right. I won't make you stay there too long. I know it's tough, but Jeff's doing a couple of great things here. He's keeping his hands nice and close to him as if you were to pick up that object. We want to try and keep the object nice and close to us. And if not, we want to try and get to as close as possible. Try and keep that object within our center of mass and center of gravity. That'll help us lift it back up when we need to. The other great thing that Jeff is doing here is keeping his hips really, really low. He's going into a deep squat. That helps us engage all of our hip muscles that we went over with the bridges. That helps us use all those muscles to help us stand back up. Go ahead and stand back up, Jeff. How did that feel?
Good. I need to do more squats though.
Right. I want to try one more squat because there's one thing that I do want to work on. And I'm not picking on Jeff here, but it's a very, very common thing that I see in a lot of pain, people with low back pain. So go ahead and turn to the side again for us, Jeff, and then squat one more time down, just like you just were. So again, we're noticing the 2 great things that Jeff is doing, but if you pay attention to what his back is doing, it's really, really flexed forward there. And if Jeff was one of my patients, Jeff, go ahead and stand on up again. I may say something like, Jeff, I know you reported that you had some back pain when you were squatting to lift up a heavy grocery bag or when you were shoveling. Let's try and grab a dowel to try and put on your back and try a traditional back squat like that, just as you would in the gym. Go ahead and squat down again. Good. So he's still doing the 2 good things that we mentioned before, but that back is still flexed forward. One variable that we can change, go ahead and come back up, Jeff. It's changing, not the whole exercise itself. We still want to work within that squat to try and get that a little bit more tolerable, but we can change the type of exercise. So I see you have a kettlebell there, Jeff. Would you mind putting a foam pad under your heels and then grabbing that kettlebell as well? Great. Try and keep that kettlebell nice and close to your chest and then try squatting down again. I want to try and keep the weight as close to you as possible. As you squat down, try and go into that deep squat that you did before. This time, try and keep your back a little bit more upright. Perfect. And then squat back up. Try a couple more reps like that. Let me know how it feels.
Much better.
No pain in the low back?
Nope, not at all.
Great. So as a PT, I'm very happy with that. His squat looks much better. He's still getting that depth that we like. He's still holding that weight really, really close. And he's keeping his back nice and upright as he squats down. And more importantly, as he squats back up. We want to try and lift with our legs, not our back. Jeff is a happy patient as well because now he's able to squat a little bit deeper. We'll work through that exercise until he becomes more comfortable squatting that low with an upright back. That way we can get him back to squatting during functional activities without as much pain. So like I said before, there's a magnitude of factors that we can change to make an exercise either harder or easier. Some are easier to change on your own, like we went over. Some are a little bit more challenging and should be manipulated, certainly by a skilled professional, such as a physical therapist. That was the last bullet point that we wanted to go over. Again, my name is Kyle Veltre. I'm a physical therapist. Jeff Smith, clinical director and physical therapist. At this time, we'd like to go over some of the questions that you guys may have come up with during the webinar. So we're going to invite Amir back on screen here. That way we can go over some of the questions.
Awesome job, guys. I did a few of those exercises with you, and I got to tell you, I'm sure if everyone followed home, along at home, they'd be super fatigued and sore by now. All right, good to be back with you guys. We hope today's talk was valuable and you learned more about low back exercises and how to prevent and treat some of those discomforts you might be experiencing. We are going to now take a look at your questions that you put in the Q&A feature and help you guys sort through those now. So Kyle, Jeff, we've got a bunch of questions here for you. I'm going to start with a pretty simple one. I think it's a good foundation though. One of the attendees here wants to know how they can find neutral spine position.
I can take this one, Jeff.
Definitely.
All right. So neutral spine. Yeah, great question. So the natural curvature of our spine is an S shape. So we like to think of trying to keep your back nice and flat, but really it is naturally curved. So an easy way to try and do that, I'll join the ground again for that, is to try and think of pushing your lower back into the floor by rotating the pelvis back down. So as you can see, my back is nice and arched here. We want to try and flatten that curve by pushing the belly button down towards the ground. You could even feel the front of the pelvis here to help you rotate that back. That'll help you rotate that pelvis into that neutral spine, and that'll help you find that S curve that we're looking for again.
Great. Thanks, guys. While you were demonstrating one of the exercises, I think it was dying bug or dead bug alternating legs, someone mentioned, can you put a small towel in the small of your back to help you not to arch your back?
I'll take that one. That's a great question. So it's a good in the beginning to have the towel there just to help you feel yourself pushing into the towel. However, we don't want that to become a limiting factor as we continue to progress this exercise. So generally with my patients, I'll have the towel in there for the first maybe day or two we're doing this, just so they can feel their back pushing into that towel. However, eventually want that back to be completely flat on the ground, and that towel would limit us. So it's okay to have it in the beginning, but as you progress the exercise, we definitely want to make sure that towel is going away and it's your low back getting flat on the ground.
Great. Here's a nice general question for all of these exercises. Someone wanted to know how frequently we should be doing these exercises.
Yeah, so it depends. Yeah, you gave me the tough one. It's a tough answer, and it honestly depends. There's different types of exercises that we're targeting different muscles or different impairments, right? So we mentioned a little bit of mobility exercises, then some stretches, and then some strengthening. Generally, we don't like to do the strengthening every day. However, if there is only impairments in that realm and we're just focusing on strengthening, it is okay to do those more frequently. For someone with general low back pain, however, I like to start them off with more mobility and more stretches, doing those more frequently, and then slowly introducing some more strengthening. The thing about strengthening is the muscles do fatigue, and the muscles need time to recover much more than the stretches and the mobility does.
Great, thanks, Kyle. Here's another good one. Any tips or suggestions for taking care of the lower back when weightlifting? For example, deadlifts, anything overhead, things like that. They also said, thanks for hosting this, guys.
Definitely. I'll take this one, Kyle. It's a great question. Keeping the core, if I'm understanding correctly, just making sure that the back is protected the whole time. There's a lot of devices out there. There's belts, braces, all kinds of cool gadgets out there. The best advice that I have with my weightlifting population especially is keeping the activity light and going back to what I mentioned earlier, quality over quantity. So I would rather my athletes who are working out, I'd rather you squat 100 pounds with perfect form, keeping that spine neutral, keeping that core nice and tight, than squatting 400 pounds with awful form. So there's really no one trick that's going to do it. It's really just making sure you build up your own natural strength, because those gadgets that you can buy, the vests and belts and things, they're just mimicking your core. So the stronger you can make your core, the less you have to worry about protecting your back with outside material.
Great. This one I think really would impact a lot of our viewers today. So someone wants to know, what if squatting is too difficult? I need to pick things up, but squatting is difficult.
Yeah, so great question. It could be due to a couple of different things, right? So as we mentioned, the squat isn't just the back, it isn't just the hips, it's involving a lot of different components of the body. It starts from the ankles, goes up to the knees, into the hips, and then into the back. So any one of those restrictions can cause a limitation in the squat. I think the best answer that I could give you is to be for a full examination and full evaluation. We can really assess those joints a little bit better, see which one is sort of the biggest restrictor, see if there's anything that we can work on specifically to help you get into a much deeper squat and a little bit less pain as you squat down.
Great. Here's an interesting one. Foam rolling for lower back, good or not good? I've heard some say don't do it.
That's a good one. Kyle, do you want this one?
I'll try. Yeah. So again, it kind of depends. There are very long muscles that travel along our spine, as we saw in the first slide that Jeff went over. A lot of times those do stiffen up, especially as we're sitting more often, just with the technology, working from home now, they can stiffen up. Foam rolling is good to help loosen up that soft tissue. However, like I said before, we want to try and avoid overextending or overflexing that spine as well, which the foam roller predisposes us into those positions. So I'm not a totally no against foam rolling, because there is a certain time and place where I would prescribe it. But in general, I would be very, very careful when foam rolling the back because of that very reason of the S-curve of the spine.
Yeah, I like jumping on that too. If you are having a lot of low back pain and it's difficult to foam roll the low back, because if you remember that first slide we had, there's really not a lot of muscle in the low back itself. You could probably even go in the back and poke your own tailbone. A lot of the muscles that are going to be causing low back pain are generally going to be in the glutes, the hamstrings, or more on the side here. So I would recommend rolling, if you can, foam rolling more glutes, hamstrings, and the side of the back, as opposed to big sweeps up and down the entire back.
Great. So this is a rather specific question, but I think we can make it a bit more vague for the masses. So the person said, how about breathing and the use of breathe right strips? So that's the specific part that I was referring to. The real big vague question here is, does breathing impact back pain?
Yeah, for sure. We'd like to think of bracing as another term that we similar to core engagement or bracing the spine, especially when we're performing those heavy lifts like a squat or a deadlift, right? We want to try and engage that core while still maintaining breathing. So previous webinar that we had, we went over that pretty in depth with TA bracing, it's called, which is a very specific exercise. But generally, yes, we want to try to work on those breathing mechanics, especially as we're getting to more Olympic lifting and more difficult exercises. It's really important, and it plays a huge role, breathing exercises in dynamic lifts.
Yeah, I would say if you are having difficulty with breathing, the breath, I don't remember the exact name brand of the strips, but I'm assuming it's the ones that go over the nose and help open up the airways in the nose. If you're having difficulty breathing, I would say maybe talk to your doctor, your general practitioner, to see if maybe there's something else going on, a sinus issue going on that's preventing you from breathing. And that might be something you can look into as well, if that's causing any difficulty.
Okay. Here's an interesting one. For those clients with poor ankle mobility, what would you recommend to improve squat depth?
Love this question.
Yes.
So I almost set this up for my last answer, but like I said, the squat is multifaceted. It's multi-joint. We're working a lot of different joints all at the same time. If we don't have enough ankle mobility, especially into dorsiflexion, which is bringing the knees over the toes, we're going to compensate at higher joints up the chain, whether that be the knee, the hip, or the back. That is why I had Jeff perform the goblet squat while he held the kettlebell towards his chest. With his heels elevated, he was further able to go deeper into the squat because he was taking away essentially the restriction from the ankle. So Jeff, if you want to demonstrate that. Yeah, so you can see how his heels are already elevated. As he squats down, if there's a restriction in the ankle, it won't be as impactful in the depth of his squat as he squats down. Good. Nice.
I hope you all can appreciate that authentic siren in the background from our New York, New Jersey streets. Just trying to keep it real for everybody.
Sorry about that.
No worries at all. One of our viewers wants to know, how do we know if lower back pain is from our hips, psoas, hip flexor, or perispinal?
A great question, and your physical therapist will be able to give you the exact info on that one. It's a really good question. It's tough to say because those structures are all so close to each other in the lower back, in the glutes, and it's all connected. Literally everything is connected. So it might be a little bit from your psoas, a little bit from your glute, a little bit from your paraspinals. It might be all, it might be one of them. So it's tough to say just kind of a general sense. But the best thing I can say is go see a physical therapist. They'll be able to do different tests, different assessment techniques, and see exactly what muscle or muscle groups are involved with that.
This person has a pretty wide open-ended question. I feel like we covered it a little bit, but it could be good to review. The person would like to know how to engage the core correctly.
Yeah, so it's similar to finding that neutral spine that I went over when you're lying down on your back. Once you start to feel that pelvis is rotating, you could even start to feel a little bit of that muscle, that TA muscle, the transverse abdominis, that we like to engage as we engage our core. So I'll demonstrate.
Jeff, you want to take over there? It looks like he might have frozen up there.
Yeah, I got it. So I'm not quite sure where he was going to go with that, so I don't want to steal his thunder. But, oh, is he back?
There he is.
Kyle, sorry you cut out. You didn't get on the floor yet. You were just giving us a brief explanation.
You could go then.
Okay, so one cue that I like to give my patients is I say, imagine if you were going to be hit in your belly with something. Someone was going to smack you or you're going to run into something, how you would brace for that impact. That's a kind of quick way that I can have people, it's a kind of an automatic reaction to have that quick brace. And then you'll at least feel the muscles engage in that area. And you'll kind of get a sense for what it feels like to engage your core. As you work more with your physical therapist, or as you start to get those muscles stronger and develop those muscles more, you'll feel that contraction more as you're doing the activity. Kyle, you want to dive in and finish your explanation? You're on a good track there.
Yeah, it was very similar. I was just going to palpate the hips. Hopefully I don't freeze again here. So as I come down into the position again, you can feel in the front of your hips here, right above the belt, or right below the belt line, you'll feel like two little protruding bones here. It's really just the pelvis. You can palpate there, and then as you brace, like Jeff was explaining, like someone's about to punch you, you'll feel a little bit of muscle activation happening across between the two pelvic bones. That'll let you know that that muscle is being engaged. That's just a good cue to help activate that specific muscle.
Great. We have time for a few more. This is a very appropriate question for the time. Any suggestions for low back pain while sitting and working from home so much?
Yeah, there is a ton of things we can do. The first thing I would recommend is look at your workstation. I know we're not all, especially in our New York apartments, not really have a home office. Most people don't have a home office. So it's kind of just whatever you have around the house, sitting on your couch, lying on your bed. The most important thing is keeping the torso upright. So we don't want to be falling into this kind of position, or we're falling back into our bed like this. So the important thing is having an upright posture. So we got some upper back support, and then having a lumbar roll, a small pillow, something in your low back to provide a little bit of low back support. You also want to make sure that your computer is at a decent height. I say roughly you want the webcam area of your computer should be about eyebrow height when you're sitting there. So this way you're not going to have falling into that, looking down at your screen, working type of deal, or you have a standing desk and you're up in this kind of position. So that screen should be about eyebrow height. You'll have some support for your upper back, support for your lower back. And the most important thing I tell all my patients with lower back pain is to set a timer on your phone to go off every 30 minutes or every hour and get up out of your chair. Even if it's a quick 5 seconds, just standing up and just doing a couple twists side to side, maybe try and stretch out the legs for a little bit, and then sit right back into that meeting or that project you're working on. Even just changing the position for a couple seconds is going to make a big difference. So we don't want to get stuck in that sitting posture for too long. That alarm is a nice kind of outside reminder for you to get up, especially working from home. When we're in the office, we're getting up all day long. We're going to meetings, going to the bathroom, going to the copy machine. It's a lot of activity you don't even think about. And now that you're home, you're not doing all that activity anymore. So make sure you're getting up throughout the day to keep the blood flowing and keep that back from getting stiff.
Great. So this is a very common question for people in a gym setting. How would you handle the progression of someone who's trying to get stronger in terms of reps? How many for how long, and then increasing by how much?
Kyle, this is all you.
There's different principles for the type of strength that you're trying to look for, right? So there's power, there's endurance, there's hypertrophy, there's different repetitions are going to lead you to that specific type of strength improvement. So for more endurance, obviously we want to try and strengthen that muscle for longer periods of time. Picture the plank example, right? That's a more endurance type of exercise versus the V-up is more of a repetition, right? So if you're looking to develop those muscles and develop more strength with that, try and stay within that 6 to 10 rep range and hold it for shorter amounts of time, and give yourself more rest breaks between each set. That'll help the muscles recover and be applicable the next time you try and ask them to do something. So if you're doing 3 sets, maybe try and do 3 sets of 8, but after a set of 8, take a nice break, try and let those muscles relax again, and then try the second set. Versus, again, if you're looking for more endurance type of strength in the core with a plank exercise, you can hold it for longer and try fewer repetitions. And that's pretty much a general principle going forward with, you could apply that to basically any muscle in the human body.
Cool. Going back to the squatting, someone's mentioning here that they've heard squatting puts max load on your kneecaps. So we all know that it certainly does put extra wear and tear on the knee, right? So does it make sense to not do them more than once a week or even less frequently? That was the question there.
Yeah, I'd like to talk to especially my heavy gym goers and weightlifters about what their previous protocol was and what their exercise prescription was. I try and stay as close to that because I don't like to mess with people's schedules and routines. It's certainly, especially as you go up in weight, we certainly know that increased weight can affect certain joints differently. I generally like to do the 48-hour rule, which is try not to use the same muscle group within a 48-hour time. So if you're going heavy on legs or doing a lot of squats, a lot of deadlifts on a Monday, try not to go back into that same muscle group until at least the Thursday. Give the muscles, again, adequate time to rest and recover. So that way, when you ask them to do similar weights or similar exercises the next time, they're not fatigued from previously, which can be a risk of injury or re-injury of a previous injury.
Definitely. And another important thing too is make sure that your form is good. So if you have the ability to squat in front of a mirror, that's going to be the best thing so you can get a better sense of your form. If not, try and have somebody watch you or set up a camera to watch yourself. And the important thing with taking stress off the knee is going to be make sure that the knees stay behind the toes. So a lot of times people squatting and they do this kind of action, this is going to put a ton of stress on those kneecaps, even more with the weight. So we want to make sure that the knees are staying behind the toes as we're going down to that squat. You're still putting pressure on the knee with the action of squatting. However, having the knees behind the toes is going to lessen that, we call it shearing force a little bit in there. But I think that if you are having pain with squatting, you're not really doing super heavy weight, definitely have somebody look at your form to make sure that your form is correct.
I think we have one good one here I think we can end on. It's rather open-ended and wide for us to cover a lot here, and I think it's very topical. So since I've been working from home during COVID-19, I find that my body is stiffening up. What's the best exercise or exercises I can do at home to keep my body active? I'm thinking of buying a stretch exercise resistance band. So I think it was just a good question here for the masses to hear about some ways to keep active at home during these weird times we're in.
Yeah. Kyle, you want to start?
Yeah, I'm going to piggyback off of your answer from before. about trying to maintain good posture first, right? And it's sort of a perfect way to end, like Amir was saying. It's really the progression of exercises as we went through today, right? We want to try and mobilize the spine. We don't want to just go into a heavy squat or a heavy lift without warming up the body, especially as we're working from home longer, sitting for longer hours. The hip muscles, the back muscles get really, really tight. Hip flexor tightness is very common. I've seen that a lot recently. People complaining of increased extension out of the low back with pain. So trying to do some stretches always first, mobilizing the spine, doing some gentle range of motion before getting into some more strengthening exercises is usually the way I like to progress. So that way we're not going in from a cold state to a very heavy lift. Those muscles, there's less blood flow to the muscles. They're not going to be as strong or as adequate to perform the movement that you're asking them to do.
Yeah, and going off of that too, in addition to making sure that your posture and workstation are set up, just in terms of general stiffness, getting up and moving is the best thing. You know, even if it's just one set of squats or a set of bridges on the floor, or you're doing a hamstring stretch in between Zoom meetings, just getting up and moving, going outside for a walk, moving around your apartment is going to help prevent that stiffness. Our body is really adaptable to the stresses or stimulus we give it. Sorry, the air conditioning just kicked on. It's very adaptable to stress or stimulus that we give it. So if we start sitting for 8, 10, 12, 15 hours a day, our bodies are going to adapt and say we have to get really good at sitting. So muscles will shorten, muscles will tighten up on you. And then when you try and do something active, working out, running, or whatever, the body is going to be really confused and wondering, why are we trying to move and run? We were supposed to be sitting 15 hours a day. So you want to make sure that you're staying mobile throughout the day. Like I said, changing positions throughout the day, doing stretches in between meetings, going for a walk around the neighborhood, just getting up out of the chair and moving around to be your best first line defense against that general stiffness, discomfort with work from home.
Great, guys. Appreciate it. Well, look, everyone, we hope today's talk was valuable and you learned more about low back and core exercises. If we didn't unfortunately get to your question, please feel free to reach out to us and we could set something up for you to handle those directly. We'll also be sending out a handout after this webinar with a recap of important facts as well as exercise references for you to have. As a reminder, your presenters for today were Jeff Smith and Kyle Veltre. Both are physical therapists from our 30 Broad Street location down in Fidei. Feel free to jot down their contact info so you can reach out to them directly with any questions and to schedule an appointment if you feel that that's appropriate. I'll give you a minute or two to jot that down. Great. Our Q&A moderator was Don Squire, another physical therapist and clinical director at our Penn Plaza location. And again, my name is Amir Rand, Regional Director here at SPEAR. Feel free to reach out to us as well with any questions, and we'd also be happy to facilitate getting you set up with one of our great therapists. As most of you know, at SPEAR, we treat an array of conditions from head to toe. As a reminder, we're open for in-person visits as well as telehealth sessions. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any one of us individually, and we will personally coordinate your care. We will continue hosting webinars into the new year, and we'll be covering a variety of topics, so please stay tuned to social channels for more information. We look forward to seeing you there. Thank you all very much for spending time with us today. We hope you enjoyed our webinar and wish you the very best. Be well, stay warm and safe out there.
Thank you all. Happy holidays.
Take care. Happy holidays.